Hi, my name's Kevin Camacho, and I'm going to be talking about peritonitis. Peritonitis is an acute or chronic inflammation of the visceral or parietal peritoneum that can have life-threatening complications. Peritoneum is a thin layer of tissue covering the inside of the abdomen and most of its organs. The peritoneal cavity is a space between the parietal peritoneum and the visceral peritoneum. Some symptoms of peritonitis are abdominal tenderness, bloating, nausea and vomiting, diarrhea, constipation, fever, and chills. So peritonitis can be a dangerous pathology because there's a massive fluid shift. Basically, with this kind of infection, fluid can shift into the peritoneal cavity, and the amount of fluid that shifts can cause dehydration or even hypovolemic shock. The buildup of the fluid in the abdomen can throw off the pressure in the abdominal cavity and cause acute respiratory distress even. On top of the aforementioned issues, peristalsis can stop due to the inflammation in the cavity, and this is known as a paralytic ileus or an adynamic bowel, which can lead to bowel obstruction secondary to peritonitis. Some of the causes of peritonitis are bowel perforation, peritoneal dialysis. These two are the most common sources of this issue. Bloodborne organisms are usually what causes this problem in the first place. It's a type of infection in the abdomen, essentially. Genitourinary tract organisms also. Psoriasis with ascites can lead to peritonitis or secondary to psoriasis. A ruptured appendix can also cause peritonitis. Same thing with the ruptured diverticula. And trauma to the abdominal organs can cause peritonitis as well. So, diagnosis of peritonitis. So, labs, CBC, just like all the stuff that we've already been looking at, like the markers or signals for inflammation and infection, like elevated white blood cell count. Fluid analysis of the fluid buildup in the abdomen can be utilized to diagnose peritonitis as well. This is just withdrawn with a needle and then assessed or sent off to the lab for culture to basically identify the microorganism that's causing the infection. Additionally, imagery such as a CT and X-ray can also identify peritonitis, but it won't identify, obviously, the microorganism causing the illness, so it wouldn't help with directing what kind of medication you would want to give to these patients, but it will at least help you identify that there is fluid building up in the abdomen. Medical interventions, IV antibiotics like clindamycin, ciprofloxacin, Cipro, vancomycin, Ancef, and Flagyl. Antifungal medications, depending on the etiology of the peritonitis, can be utilized. If peritoneal dialysis is associated or is the cause of peritonitis, you'd have to find a different method for dialysis until the patient has recovered from peritonitis. So one of the options would be like hemodialysis. While it's not as convenient, it would just be for a temporary amount of time while the patient recovers from the peritonitis. Emergency surgery can be required depending on the severity or the cause of the peritonitis. Like we had already spoken about, if If a bowel perforation is the cause, then most likely surgical intervention to fix the bowel perforation and address some of the peritonitis would be ideal. As far as nursing interventions go, monitoring vital signs, administering antiemetics, because the patient will already be dehydrated somewhat from the fluid shift into the abdomen. So you want to make sure that they're not losing additional fluid through emesis. Maintain accurate intake and output and correlate the patient's daily weight. Now we know as far as fluid shifts go, that can really show up on the scale. So if the patient's retaining a lot of fluid in the abdomen, you'll be able to see as far as their daily weight increasing. And this can also show you a trend to see if your interventions or your antibiotic is working to minimize the fluid retention. Measuring urine-specific gravity can also be an indirect way to measure fluid retention. Administering antibiotics as prescribed, and monitoring for sepsis or shock. This is something that you really want to keep an eye out with these patients. Peritonitis, like the different causes that I've already mentioned, some of them can already be an elevated risk factor for sepsis. So anything with the bowel perforation or appendicitis or even perforated diverticula, that's going to be something that you're going to want to monitor the patient for symptoms of shock or sepsis.